Thank you for coming to the recording of our ICAM webinar on how the COVID-19 pandemic has impacted dog and cat population management, broadcast on June 15th, 2020. This recording has been edited to remove some sections of the webinar where we had audio difficulties. However, the content of all the presentations has been retained.
Good morning, good afternoon, and good evening to everyone. I am Pankaj KC, Director of Community Animals Program in World Animal Protection and current Chair of ICAM Coalition. Thank you so much for your overwhelming interest in this webinar. We are now going to start the webinar. But before we start the webinar, we wanted to do a couple of opinion pollings. Can our host please share the opinion polls? You will see the opinion poll coming in your screen, and please do choose the option that most relates to you, and then we will share the results of that. Thank you. There's the result of our poll. It's fascinating to see that we have significant majority of those who are working on veterinary services. Are we doing another poll as well? Can we put that? Thank you. Seems like there is quite a lot of activities that had to be completely stopped or had high restrictions on it. It will be good to understand from those 8% whose activities didn't stop at all. There might be some learning for us in there. Thank you very much, Elly. Okay, so on behalf of ICAM, I would like to wish that all of us are doing well and coping well in these uncertain current times. The current unprecedented global lockdown situation as a result of COVID-19 has impacted every single individual and institutions globally. Furthermore, it's not just humans that are suffering from this. Animals, our beloved pets, particularly dogs and cats, around the world are too. Their suffering is primarily from the misinformation circulating around the world on whether pets can be source of COVID-19 infection. As a result, people are confused and taking some extreme measures, including abandoning dogs and cats in the streets and in shelters. Like many of you, members of International Companion Animal Management Coalition has been campaigning to protect companion animals from this impact of COVID-19. This webinar is also our collective attempt to further understand, improve, and strengthen our knowledge on this front so that we could campaign better to protect companion animals. We have 5 excellent presentations from experts lined up for you in this webinar as a fuel for discussion. This will be the lineup of our presentation, and each presentations will take around 10 minutes to present. We will start from Dr. Elly Hiby to Dr. Nat Lee to Dr. Katherine Polak, and Keren will take us through how to feed stray dogs and own animals, and Coralie from RSPCA and I will be having some discussion on campaigning for dogs in the post-corona world. So before I invite our first presenter, I'd like to briefly introduce ICAM Coalition for those who are new to this. So ICAM is International Companion Animal Management Coalition, formed in 2006 as a forum for discussion on global dog and cat population management. Our key goals are to share ideas and data, discuss issues relevant to population management and welfare, agree definitions, and hence, improve understanding and provide guidance as a collegial and cohesive group. ICAM supports the development and use of humane and effective companion animal population management worldwide. On that note, may I please invite our first speaker, Dr. Elly Hiby.
Thanks, Pankaj. Let me get my my slides up. Okay, so what I'd like to talk about today is how our populations of dogs and cats may be responding to restrictions on our population management work. Now, currently those restrictions are likely to have been caused by government imposed lockdowns, but of course our activities can be disrupted for other reasons. I'll be focusing a lot on sterilisation today, but I wanted to emphasise that I am acutely aware that this is just one part of the humane population management system, as described in our guidance on dog population management available on our website. However, access to reproduction control, often achieved through sterilisation, is a fundamental part of all humane management interventions, and is also a service that has been acutely disrupted by COVID-19. Now, I know we are all working extremely hard to manage dog and cat populations, and it's not uncommon to feel like we're in some kind of race against time to get on top of the situation. And then COVID hits, entire countries are locked down, and we are told to down tools and head home. And the natural feeling for many of us in response to this news was panic. Now, I'm not about to tell you that these pauses in our work are irrelevant, but I think the impact may be less than we initially feared. And I think we should also take this opportunity to celebrate how our work has contributed to community resilience during lockdown by reducing conflict with dogs and cats, and use this as a moment to advocate for more and better population management in future. So I'm going to be using a visualization of roaming dog population dynamics, and I'm using dogs as an example here, but cat population dynamics are similar. And I'll share with you some of the data from cat population modeling later. So here we have a hypothetical population of dogs, blue males and orange females. So the population dynamics that we see here includes birth and unfortunately the death of many of these puppies. But some do survive and they make it to adulthood and they replace those adults that die, becoming part of the breeding population themselves. And this is basically population turnover. There's one additional process that is really important that I haven't mentioned yet. These are not closed populations. We also see immigration. So that can be dogs moving in from other areas, or it can be abandonment or loss from homes. And I think many of us are acutely aware of how influential this process can be, with populations appearing to resist the declines we expected to see following high sterilisation rates, because immigration counters those declines. And that's why ICAM always recommends using a comprehensive population management system with services that address all the sources of unwanted dogs, not relying on only one approach, such as catch, neuter and return used in isolation. So this population turnover continues, and what data we have suggests that in the absence of any intervention, the population size stays relatively stable with some fluctuations from year to year. But if the carrying capacity of the habitat stays the same, this will limit survival and breeding, keeping a lid on population growth. So carrying capacity includes those classic resources like food and shelter, but I would also include human tolerance in there. Many of us will have experienced culls and poisoning when people perceive the number of dogs to have exceeded what they are willing to accept. So now let's take a look at what happens when we have two contrasting interventions in place. So here we have two separate populations of dogs experiencing two contrasting interventions. On the left is culling and on the right is sterilisation. So we have the same population dynamic processes, but happening at different rates. In the culling scenario, we obviously have high mortality from the cull, but this brings the population well below carrying capacity, and all the remaining dogs have the capacity to breed. So the birth rate and the survival of those pups to maturity is also high. So this population rebounds after the cull. What we are seeing here is high population turnover. In this visualization, we see culling and rebounding happening in cycles. It's not unusual for culling to be used sporadically, with the population brought suddenly down, then ignored as it rebounds, then the number of complaints grow and the culling teams return. Contrast this to the sterilisation scenario, where obviously the birth rate is lower, and so is mortality because there's no culling. So the population has slower turnover and can be described as more stable. So the population makes its way steadily down to the same level that we see immediately following a cull, and this is where coronavirus hits. So what we see in these two contrasting scenarios is that the population controlled using culling is going to rebound, as it always does. But in the population where sterilisation has been used, their ability to rebound is far reduced. And the higher the sterilisation coverage you have achieved, the more robust this population will be to any pause in activity. And I just wanted to take a moment to remind us what rebound in this culling scenario looks like, because this is not just a numbers game. This involves a high level of breeding behaviours, which are a welfare risk for the dogs and a real nuisance for the community. It involves the birth of a lot of puppies, many of which end up dying in their first weeks and months. Again, an animal welfare cost, and also very upsetting for the communities to see. So when we are advocating for humane population management, remember this is not just about a way to reduce population turnover and numbers of dogs. This is a way to reduce suffering and conflict for both animals and people. But getting back to numbers, I'm conscious that your question may be, I know that sterilised populations are more robust than those controlled by culling, but how much more robust? And to answer that, I would like to turn to some computer modelling of cats to give us an indication. We're looking here at an initiative by the Alliance for the Contraception of Cats and Dogs. They worked with partners to build a computer model of free roaming cat populations so they could compare intervention types and explore whether a non-surgical contraceptive would be a useful tool. Now, I'm not going to go into how this model works, but if you want to know more, please go to the ACC&D website and look under their flagship initiatives for population modelling. But they use this same model to explore what would happen if a trap, neuter and return project was halted for an entire year because of COVID-19. Now, I do appreciate we've just jumped from dogs to cats here, but as cats tend to be more successful breeders than dogs, our hypothesis is that dog populations receiving the same sterilisation intensity would be even more robust. So let me walk you through what the results from this model. So you start, pre-COVID that is, with 50 cats in the colony, about half are female, and at the start none are sterilised. This graph shows the number of fertile females vertically and the year since you started TNR on the horizontal axis. For 2 years, you sterilised 75% of all fertile cats every 6 months. We call that level high intensity TNR. The model lets fertile cats have kittens and importantly also allows for immigration. So the original cats aren't your only target for sterilisation. Now looking at those 1 year spay gaps. The green line shows that you have been working diligently with this colony for 2 years and then you shut down for a year. If you follow the red line, you see what happens if you were 5 years into TNR before the 1 year shutdown. As you can see, across both scenarios, the COVID-induced sterilisation gap adds very few fertile female cats over the 12 months of no activity, and then you catch back up. So what does the entire population of your colony look like? In this graph, it's not just fertile females, but also sterilised females and males. So total adult abundance starting at 50 and declining over 10 years. The blue line shows what happens when you sterilise 75% of fertile females every 6 months for 10 years. The green and red lines show what happens when there is a 1 year COVID gap in your programme at year 2 or year 5. The colony stabilises at about half the size, with a balance between sterilised resident cats and the influx of new cats that join the colony. For both the early and the late TNR gaps before that time, you can see the impact on overall abundance is minimal, as these lines barely diverge. Now, you may be saying, we're not sure what percentage of cats or dogs we sterilised, or we didn't sterilise that higher percent, especially when we started out, in which case you may relate better to the next example. In this colony, the project has done what it could and sterilised just 25% of fertile females every 6 months. The blue line shows the reduction in fertile female numbers. Like before, the green line shows the impact of a 1-year shutdown after 2 years and the red line after 5 years. As you can see here, the rebound effect is somewhat more substantial in each case, and it takes 4 or more years to catch up to where you would have been without a gap in activities, which is shown by the blue line. But you do still catch up lost ground. Looking at total numbers of cats at this low intensity TNR, the total reduction in colony population is noticeably less than in the 75% scenario, even without the gap. At this lower level of intervention, both lines for the scenarios with gaps don't quite catch up with the original programme until after the period of time shown on the graph. However, you don't lose all the progress you have made, and this is with a substantial gap of 12 months in activity. An interesting additional learning from this model comes from comparing the costs of these two TNR programs. Now, you'd think that high intensity costs more, but actually it only costs 3% more than the low intensity. And that's because you prevent the births of many more kittens by starting out with this high intensity sterilisation. And you obviously don't spend money spaying kittens that were never born. So if you do have the option of flexing when and how you spend your budget, try to use what is called front loading your effort, which means spending the majority of your funds in a big push of activity at the beginning to drop the population of fertile animals down as far as possible within the first effort. Then you are left with maintenance sterilisation to keep the coverage high. So in summary, sterilised populations are more robust to COVID-19 delays in activity than those without intervention or controlled using culling. This robustness or lack of rebound brings not just benefits in terms of numbers, but also animal welfare and reducing conflict with people. The more animals you have sterilised, the less rebound your population will show if your activities are paused. And front-loading your sterilisation efforts is a cost-effective way to manage populations. Now, I understand that front-loading is not simple to put into action, but it's something to think about as you restart your activities after COVID delays. Okay, thank you very much for listening, and I'm going to hand back now to Pankaj and see if there's any questions that I can help answer.
Thank you very much, Elly, for nicely making the case for sterilisation and continuing sterilisation activities and how it benefits during the uncertain times that we are living right now. If there are any questions, there have been a couple of questions that has been live answered as we were moving along, but there is one question in relation to the availability of AC, C, and D study, and if so, to please provide the citation. And if there are any more questions, please do continue to type on the Q&A box, and our panelists will live answer all of those questions as the presentation is happening. But if you have any further questions, please do type anytime. Elly?
Yeah, I'll pop the link to the ACC and D study into the Q&A and also into the chat. So there are 2 published papers already from that model. There's a third one that's in a sort of proofing stage at the moment. So, and the third one is about the economics that I mentioned there. So I'll pop that link in as soon as I can find it.
Fantastic. While that is happening and while the participants are typing the Q&A, any questions for Elly? We can swiftly, actually before moving on, I have to apologize that I didn't introduce Dr. Elly Hiby. She is the Coalition Director for ICAM. Now moving on to our next presenter, who will be talking about the risk of companion animals becoming infected and being infectious, and the case for not testing companion animals. May I please invite Dr. Nat Lee from World Small Animal Veterinary Association. Dr. Nat.
Hi, thanks Pankaj for the introduction. And hi everyone, so welcome to our webinar. What I'll be doing is I'll just be covering the very basics of COVID-19 and how it's related to companion animals. And when I'm saying companion animals, we are actually specifically looking at just cats and dogs. Also, one thing to understand about this is that it's a very new disease in the world with this COVID-19. So therefore, it's been already almost 6 months now. So therefore, there are some data that we know, but there are still quite a lot of data that we don't know yet. So as I'm speaking, understand that I'm using the data at the moment that we have, and as we go on, we might find more new things to add on to this knowledge that we have right now. For those of us that's been working with lots of cats and dogs and maybe even other animals, we do understand that coronavirus is actually a very common virus. You see it in different diseases in cats and dogs. And the COVID-19, what we're talking about, is of a different genus altogether. So it's very different type of coronavirus to the usual ones that we find affecting cats and dogs. And just to make clear the terminologies that we'll be using right now, when I mention SARS-CoV-2, I'm talking about the virus itself. And this virus, when it infects an animal or infects a person, it will cause COVID-19. So COVID-19 is the disease. So both of these are slightly different terminologies, but it's related to the same disease. Now, at the moment, we know also in humans, the reported cases has been more than 7 million. I think we're almost reaching the 8 million point in humans at the moment. But what about in companion animals? What do we see? I think almost around beginning of March, we started getting we started getting reports of a couple of companion animals having coronavirus or COVID-19. And then we started getting a few more. So from Asia to Europe to America, we start hearing about different animals getting COVID-19. And then we also started hearing about different research that's related to companion animals. And after a while, this kind of things is not so newsworthy anymore. So we stop hearing as new cases emerge. So what do we do? How do we know how many animals have got it so far? Well, the best thing to do is actually to go to the organization that's actually in charge of collecting data on how many animals in the world has it, which means the OIE, or the World Animal Health Organization. So if you go to their website, they have a list about of the different animals that got COVID-19 so far. But because of the way it's reported to them, and also it's a new disease in the world, so they don't have it in their usual website to track all the different animal diseases. So some of this data might be late to be announced onto their website. So if you want to get early knowledge of the different animals that got COVID-19, you can go to the other website, which is called ProMed. So if you subscribe to them, they will email you updates on coronavirus every day if you want to, or you can go to the website and search for coronavirus and animals, and then you can have a list of all the different reports that's happening all around the world. So what does it mean for us with all these numbers that's coming in, and what do we know at the moment? So if we look at this nice graph, it tells us a lot of different things at the moment. So we know we have a lot of human cases. We have more than 7 million cases. And we know that dogs and cats definitely can get COVID-19. But the numbers at the moment, we have 3 dogs that have COVID-19 that's been reported, and around 11 cats that has been reported. So we also know, if you really compare the numbers of human to animal cases, we know that they can get it, but the chances of them getting it is very, 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 very low. And we know also from reports of incidents where they don't get it, where animals has been tested and it's proven to be negative, even though they have been exposed to human cases, we know that not all animals get it as well. So it's not that easy for animals to get it. And in fact, if you looked at how the animals have been getting it, all of the positive cases so far is related to a human positive case. So it's usually their caretaker or their owners who live in the same household that passed on the coronavirus to the cat and dogs. Do cats and dogs pass it on to other cats and dogs? Well, we know that from laboratory experiments, because cats seems to be more susceptible to this virus and they can actually pass it on to other cats, but there are no evidence in dogs for that happen yet. And I also say that this is all laboratory experiments, so we don't have actual cases in real life where this has happened yet. And luckily, we also have no evidence at the moment where cats and dogs can pass it back onto humans. So that's a good thing for us. That means that the chances for them to spread back to humans is very low. But we also know that the primary risk for us humans to get COVID-19 or even animals to get COVID-19 is from other humans. What happens when the animal is positive? Well, a lot of animals that are positive don't show any signs at all. So there's no indication that the animal was sick. However, some animals do have signs, like mild signs, very generalized signs. We call it fever and maybe just lethargy, or maybe the animal wants to sleep more often. Some of them have respiratory signs as well, or gastrointestinal signs. But the main thing is that all of these signs, if the animal shows signs at all, is very mild signs. And after a few days, the animals recover. So it's also what we call a self-limiting disease in the animals. And based on that, what we know so far is that the shedding time of the virus from sick animals is also a few days as well. So it's very short period where they can infect other animals. So do we actually need to test all these animals for COVID-19? It's actually not recommended to routinely test all animals that's being presented to you. Firstly is there is no treatment for COVID, so it makes no clinical sense in terms of how you treat the animal that comes to you. Whether it's positive or negative, you're not treating it any different anyway. In terms of treatment, if it shows signs, you can do symptomatic relief for that animal. The other thing is that testing, when you are actually taking samples from the animals, you will be using a lot of protective equipment. So you actually want to conserve it depending on which country you're coming from. Not to mention that the act of actually bringing the animal to the vet for testing will mean that there is a risk of exposure to expose clinic staff in that place as well. And there are limitations to the type of test that's being used as well. So some tests can be too sensitive. So for example, the PCR that's been used very commonly can be positive even though there's no live virus there, and maybe just viral fragments, which means that the animal is not infectious but still test positive. And if serology or antibody testing is done, it might be too late. It might be over the shedding period as well. So the animal is not infectious anymore. So again, we need to understand the pros and cons of testing and why testing is important. So, and with all our work, we know we work with lots of animal control population, animal programs. we know that there's a lot of stigmatization when it comes to positive animals, and people fearing animals can spread to other animals or can spread to other humans. So we want to avoid that with testing. So in countries where there are some testing that's going on, where testing is what do you call it? Vets can actually test those animals. It comes along with very strict guidelines in terms of which animal is being tested. So you want to have animals that has a definite history of exposure. You want to have animals that are showing signs. You want to first rule out all the other diseases first. And also you must have a plan what you're going to do with the animals when it tests either negative or positive. So how does testing help you with your plan? What can you do? Let's first look at the definition. So OIE's definition of a suspect animal is that first, the animal must have clinical signs suggestive of COVID-19, and all the other differential diagnoses have been ruled out. And the animal must have close contact with a confirmed human or animal case or suggestive case history indicating potential exposure. So those are the classification of what OIE call a suspect COVID-19 animal. But those that we considered at risk animal might be looking at the later rule there, which means that we want to look at animals that have close contact with COVID positive case. So what can we do? In general, this is the advice that I'm going to say, because I think Coralie will, at the end of today, this webinar will go into further details in terms of what you can do for these animals. So in general, what you want to do is to isolate them for about 14 days. So this might be the same as well for people who has COVID, who is isolating at home. What you can do is you can isolate together with your animal. And you want to keep animals with their owners as much as possible as well, because it helps to reduce stress in the animal. It also helps to reduce stress in the people as well. So you want to keep them together as much as possible. If you need to handle animals, use appropriate personal protective equipment. And remember, the two main things about COVID is to maintain hygiene and sanitation, which means that you need to keep on washing your hands, disinfecting the areas where the animal has been, and to maintain social distancing. So not only you're looking at maintaining social distancing with the animal, think about it, the main transmission is from other humans as well. So if you have a human bringing the animal to you, maintain that social distance with that human as well. So where can we get updated information? We need to look at reliable sources where we can get good information for us. So the first thing I'll say is, of course, you have to go to ICAM website. The second thing is WSAVA has a resource hub now for all things related to COVID and animals, so you can actually go there. And the other three reliable sources that I'll look at is the WHO, the OIE, and also the CDC website as well. And that's it for my presentation. So in summary, we should not all panic, don't rush and do something that you'll regret later. Keep updated, true reliable resources, maintain your safe distance with other people especially, and keep washing your hands.
Thank you very much, Natasha. The summary, one of the summary I took as well is that the companion animals might be infected, but they certainly are not infectious. No evidence so far on that front anyway. On the Q&A, there are a couple of Q&As that hasn't been addressed so far. One of them is, if we test a dog for parvovirus, can it be positive if it's COVID? And there are a couple of others. One of them is, are the 3 positive dogs and 11 positive cats classified positive based on PCR? Since in this case, is it not a conversion to disease as such, rather a positive PCR, and which may be a simply positive detection of a viral fragments? it came as an anonymous attendee on my screen. And is the vaccine available from Gopal Dev? Is a vaccine available for canine coronavirus? Will help in reducing circulation of virus in the population at risks. How do you want to proceed, Natasha? Do you want to type the answer while we...
I can answer a few questions now.
Yeah,
So,
please go ahead.
if that's all right. So I think those are very good questions. I think the first thing is the parvovirus and COVID. They are two different diseases. So the test they're using them is two different tests. So the dog that is positive with parvovirus has parvovirus, obviously. But if you use the COVID test kit on them, it might show, you know, a different results. They might or might not be positive. So it's theoretically positive that they can have both diseases as well, but I would say it's very, very rare. The second question is looking at the positive cases that's been reported so far. Are they based on PCR? I would say that yes, they are based on PCR. PCR test kits, PCR tests at the moment is what we call the gold standard test. So if we want to say that an animal has it, we use PCR. But at the same time, PCR is very sensitive. So it also detects traces of viral segments as well. So you might have viral contamination in the environment. So you might need to follow up those cases. So initially some animals, I think there was one case of a dog that's been tested positive and then later on subsequent tested negative for PCR. That means that it's actually an environmental contamination or some kind of problem with maybe taking the sampling in the first place. And that animal has been unclassified as having a positive case of COVID. So we need to understand what kind of test we are using if you're going to test at all. Is vaccine available for coronavirus, for canine coronavirus, help in reducing circulation of virus in the population at risk? Any vaccines for any diseases does help to reduce the number of circulating virus or bacteria in the population. But the coronavirus vaccine in dogs is not a COVID-19 vaccine. So it's two different types of vaccines. And when you vaccine for the normal coronavirus that you have in dogs, you are not going to protect it from COVID-19. So there's two different types.
Thank you, Natasha. Let's keep the Q&A going while we move on to our next presentation. Let me please invite Dr. Katherine Polak from Paws International, and she is a veterinarian who will be talking to us about how to conduct spay, neuter, and CNVR during the times of COVID. The floor is yours, Dr. Katherine.
Great, thank you. And I'm seeing now my title slide, I've just reversed the V in the N and CVNR, quite embarrassing. But anyways, let's move on from there. I just wanted to say, yep, thank you for having me. And I think this is really a timely topic, particularly given you know, the level of involvement in veterinary activities that was exhibited in the survey poll that we started with. And as you guys already know, over the past few months, spay and neuter in many communities has come to a screeching halt due to concerns largely about public health, staff safety, need for social distancing, etc. And so we really are here to kind of talk about today how we can relaunch our spay and neuter programs, you know, safely, so that we can provide the best service to the public and the people, right, in our shelter as well. I mean, I appreciate that we're probably all animal people on this call, but the reality is that, you know, spay and neuter has the potential to increase the risk of, you know, human to human contact because it does involve people, right? We have people bringing in animals, we have our staff, we have our volunteers, and we have the public. So how do we really look at, you know, relaunching our spay and neuter activities while protecting public health during this really unprecedented time? And I just wanted to start by saying, you know, COVID, and Nat touched on this in her presentation, that it's an evolving issue. And so different organizations, different countries are at varying stages of being able to function, being able to open, they're coming out of lockdown. And that really depends on their government direction, right? And so, for instance, our Paws Eastern Europe teams are starting to operate normally, right? As is our program in Vietnam. And the situation there is much different than, let's say, in the UK and the US. And so it's very difficult to issue broad blanket recommendations, because every situation is so different in regards to its disease situation. But we need to recognize that, we might need to redesign our plans and our protocols to operate spay neuter, in this unprecedented time. And that might mean having to deal with supply issues, interruptions in our supply chain, varying levels of disease that's persisting in our community, staff shortages. Staff might be ill, they might be taking care of family members, and also the financial instability that comes from our clients that might not also be able to, provide, for spay neuter services for their pets as well. And there's definite challenges, right, that clinic setups pose, because we have so many different types of spay neuter setups, right? We have brick and mortar facilities, we have mobile units, we have field clinics. And in our traditional clinics, they often operate in very tight spaces. And so the facilities might not always be optimal. And again, we might have the public showing up with animals, whereas our field clinics afford us a bit more flexibility in terms of spreading out, social distancing. They're often outside. They might be in larger government buildings. And so we might be able to space our clinic stations out a bit more. And when I say station, I mean our intake, our prep, our surgery, our recovery, things of that nature. And so I'm going to give some tips as we go through here on, how we can kind of, make sure that we, again, protect public health, but ultimately deliver the highest level of animal welfare that we possibly can, because that's, really what it's about. So just some general considerations before we get started into specific tips. It's, kind of goes without saying, but we need to adhere to government advice and regulations in terms of when it's safe to reopen and when our staff can travel, even being to pick up and trap animals. And, as everyone already knows, you're probably going to hear this over and over, but maintaining social distancing, that's a major priority from a public health standpoint. And it's not just among staff in the clinic, right? It's among our staff and it's among clients as well. If we're operating a field clinic, we're just picking up free roaming dogs, that's maybe a bit of a different situation. But if we have clients that are coming and bringing animals, or we have to discharge animals to community members and we need to communicate with them post-op instructions, we really have to stop and consider how we're going to do that now in this different world, of COVID-19. And if we don't stay healthy, our staff don't stay healthy, then, we simply can't help the animals in our community, point blank. So I wanted to say also that, communication is really key. And again, going back to clients, as much as, they can be burdensome for us. But, if we want clients, let's say, to stay in their car with their animals, right? We don't want them coming inside our building. We don't want them really having a lot of interaction with our staff. We need to communicate that ahead of time. We need to be using social media, using signage, whatever we need to get that word out. We might not want towels or blankets in the crates, right? Those might be foam mites for disease. So we need to communicate that ahead of time. So all of these things I'm going to integrate again into some of these tips in the coming slides, but I just wanted to mention that. And another consideration too is that if you aren't ready to open spay neuter again, feeding can be a really appropriate measure to start with to make sure that animals are maintaining their health. And we can also identify animals that need sterilization during that process. And I know that Keren's going to be talking about that in the presentation coming. Okay, tip number one. Tip number one is determine your organizational capacity, right? It really makes sense, particularly for us that have just stopped our spay neuter, to slow down and assess how we're going to relaunch safely, right? We need to conserve medical supplies, again, because they could be needed for the medical field, the human medical field, but also because there could be shortages in supply lines. We also need to, consider how, we're going to involve not only our staff, but again, our volunteers as well. It's just really important to consider how we're going to also use our staff potentially differently. Some clinics are actually splitting their surgical staff. So they might have a staff team A and a team B, and team A works mornings, team B works afternoons, or they might work alternate days. And the idea for that is that if one person is exposed and potentially shedding disease, it doesn't shut down your entire clinic, right? But the reality also is that most of us don't have teams that big, that we are afforded the luxury of doing that. But there are different techniques that we can kind of consider how we can, again, relaunch in a smaller scale, but then scale, up when it's appropriate. Tip number 2 is to consider prioritizing services. Yep, so for field clinics, that could include only targeting free roaming animals, or maybe that means female animals, or perhaps those that are pregnant or need care or at high risk of pregnancy. Or I might see this little dude on the right and think, oh, he probably needs some help. But again, it just depends on, your organizational capacity. For shelters, that might look somewhat different. For shelters, that might mean that animals that are ready to go into foster home. That might mean, prioritizing surgery for animals waiting for adoption. Nobody wants to foster like an intact male tomcat that's spraying, or, a female cat in heat. And so we prioritize our services based on our patients. But it's ultimately up to each clinic to decide how many surgeries they're comfortable with when operating again. And because, it's about phasing in services and also focusing on minimizing contact with people, it's going to just take more time. Like, we're going to need to start smaller because it's just going to take more time to figure out how it's going to work and how we can provide services safely. Tip number 3 is about catching and trapping, because this is such a fundamental component to a lot of our spay-neuter programs. And we have to remember that, not only are our staff, this is a potentially high-risk activity if they are encountering members of the public, right? But it's also, we have to think about our common cat trappers, right? They're often ladies of a certain age, of a certain demographic, and so they fall into that, high-risk category for COVID-19. And so we have to make sure that, this is done safely if we are going out and doing this. And so, generally speaking, in most places, catching and trapping can start up again if the trappers aren't, clinically ill, they're maintaining appropriate social distancing, they're employing good hygiene practices, but there's certainly certain considerations that we should be thinking about, right? We want them to consider potentially working in smaller groups, only in teams of 2, or working independently. Certainly wearing a mask when they go out. Each trapper should have their own set of supplies. And one thing that they can do also is communicate with caregivers whenever possible via text, right? There's so much we can do electronically. It's really, again, just this new world we're living in. And so pretty much everything can be done virtual in terms of communication nowadays. So whenever we can avoid, contact, avoiding going into people's homes, trapping at hours when there's less, people out and about in areas that are less foot traffic. Some programs, even in Thailand, they didn't stop spay neuter. Like, that's the reality. They continued going, but they moved to areas that were quite rural, that had very high free roaming dog populations. Yep. So it's important to keep in mind. And also cleaning and disinfection of traps and crates. I'm not going to go into a lot of detail on this, but we are fortunate that coronaviruses, they can be killed pretty easily with common disinfectants. And so, as long as we are actively cleaning and we have solid cleaning protocols, we don't need any kind of radical changes, but we do need to really pay attention to making sure that cleaning and disinfection is happening appropriately. Repurposing clinic space, right? I mentioned this earlier, but we need to consider how to best utilize our clinic space to ensure social distancing among the staff and the public. And this might require a bit of creativity. So again, field clinics, those are easier. You have more space to work with. We have this gentleman on the left in Sri Lanka. He's there with his dog waiting for surgery, properly donning a mask. And the chairs are spaced, 6 feet apart, right, to make sure that there is appropriate social distancing. In the middle there, we have our instrument cleaning station, and that's very far away from our other cleaning protocols because, we don't need close attention on, eyes on animals. We can try to separate these out a bit to get more space. We can also reconfigure our shelters or our intake areas to think about how animals can drop off how the public can drop off their animals without coming into contact with our staff. So some shelters are actually repurposing rooms and having crates set up where owners can put their animals in and leave. Or again, they're doing a curbside pickup method. Again, where owners are waiting in their car and staff are leaving the building and collecting that animal. But again, signage is so important because when you want owners showing up, you don't want confusion and chaos and, I can't go in the lobby and, why I want my blankets back out of the crates. No, like we want them to know ahead of time. And again, that's communication. That can be done via email. It can be done via text message. And again, that's going to depend on what type of clinic you're working in. In the field, you might not be, employing these types of advanced communication, but you certainly can put up a sign to let people know. So tip number 5 is to, really consider your PPE game, right? We want to make sure that staff have access to PPE. We want to make sure that they're wearing cloth masks. And I don't really want to spend a lot of time talking about cloth masks right now, but if you have any questions, we can talk about it afterwards. But certainly, we do want, adequate PPE, and we do worry again about supply shortages potentially. So stocking up on these things is really crucial. We can expect ongoing shortages because, unfortunately, supply chains are just not very robust. They're actually very fragile. And so a lot of programs are struggling with finding some of these materials that I have listed here. And I'm going to add a resource. I'm going to include a resource at the end of this that actually has some options of how you can kind of hand make or kind of MacGyver these things if you need to in a pinch. Certainly hand sanitizers, again, should be readily available, although we do prefer hand washing. And a big shout out, this is a picture from Miami-Dade Animal Services, who've been now working, they've relaunched their spay neuter services, and they're working through a backload of a couple hundred shelter animals. And so they've just done 135 surgeries this week, and they're just, getting started again. Tip number 6 is a big one, and this is to prepare for ongoing shortages of anesthetic drugs, particularly those that are used in human medicine for treating COVID patients. I mean, this sounds kind of strange to us, but there's a lot of overlap, and a lot of these drugs are from human medicine, right? So we know that in the US, the increase for midazolam went up about 4,000% during, the COVID scare. And so we just have to be prepared that we might have to tweak our anesthetic protocols. And it's not about using some radically different protocol. It might be different for you and your clinic, but like a lot of these protocols have been used by other, veterinary hospitals and other programs. And so there is room for adaptation. The anesthetics that we are most concerned about due to their use in human medicine include propofol, ketamine, fentanyl, and midazolam, and other drugs that could be affected include hydromorphone, morphine, and diazepam. Also have to worry about local anesthetics, lidocaine, bupivacaine, those could be impacted. And dexmedetomidine actually it is in high demand, but so some programs can get it and some can't. It's always better, if possible, to use a veterinary specific drug because those are going to be less likely to be affected, right? So diazepam and midazolam, there are no vet formulations to my knowledge, but propofol, dexdomitor, those have a veterinary labeled version. Drugs that are manufactured just for the veterinary market, those include butorphanol, alfaxalone, teledimine, which is tilazol or zolatil, and buprenorphine. So analgesics, we do have our own veterinary specific products. So that's really great because those probably won't be affected. That's butorphanol, that's buprenorphine. Again, in some countries, certainly where I practice, we can't get those drugs. And so, again, it's about being flexible. But it is a time to remember that we can use anti-anxiety medications as well as kind of a sedative or to help reduce the amount of anesthetic needed in our dogs and cats. So in dogs, that would be oral trazodone or gabapentin. And in our cats, that would be oral gabapentin as well. Okay, tip number 7 is to tweak our surgical, our discharge, and our follow-up protocols. We just have to recognize that, again, we might need to be flexible here. Following up on the anesthesia discussion, now might be a good time to integrate local blocks during your surgical procedures, right? That can decrease the overall amount of anesthesia needed. We also want to really avoid patients having to come back, right? Like, we want to do the surgery, do it high quality, the animals are healed and they go back successfully. We don't want to be seeing animals on recheck. So we need to remember to be using, subcutaneous absorbable sutures, right? We don't want to be placing skin sutures that then the animal has to come back. We also, are really dabbling in a field, in a future of telemedicine as well, which is quite interesting. And so there might be an opportunity for, video chats to check post-surgically or to talk with owners about their animal. We also want to, this seems obvious, but stagger our patient discharges, right? Because we don't want to say, okay, pick your animals up at 4 p.m. and 100 people come in at 4 p.m., right? So there is an opportunity to stagger them again, so we can minimize that social contact. I also wanted to mention paperwork, and there's a lot of discussion about this. In an ideal world, yes, our clinics would be paperless because paper can be continued a potential fomite. Is it really high risk? Probably not, but it's something to consider. Like some research suggests virus can live on paper for 3 to 5 hours. So you could use a tablet, right? Like you could use an electronic tablet, maybe in the parking lot instead of printed documents, consent forms. You can email those ahead of time. I appreciate that in many settings that might not be practical. So one way, if you are using paper, is you could think about paper flowing out, like just out, not in, right? So if you have a discharge form, or you have post-op recommendations, those are only going out. Like you don't want to be passing paper back and forth, passing pens back and forth, and certainly making sure, again, hand sanitizer that is readily available. Tip number 8, continuous team training and communication. Like these things are pretty obvious, but certainly team members who feel ill, they're staying at home, right? Increasing vigilance, again, about thorough, frequent hand washing, reminding people about PPE. And I think it's really easy to become complacent. Like even now, and certainly throughout Southeast Asia, like the numbers of COVID have been really low, comparatively. And so it's, there's definitely a degree I sense of developing complacency, but we know that, some countries are seeing a second wave already. And so we really just can't let our guard down if we want to, again, continue to provide high quality services for animals in our community. My final tip is to check out all the additional resources. So I'm going to put links, I think, in the chat after I'm done to all of these documents, but we have a really nice document from HSUS there on the left that are, considerations to keep our trapping team safe. So what do they need to do when they're out and about? ASPCA Pro has this living document on COVID-19 spay, neuter, and wellness preparation. It is North American centric, but a lot of great tips in there. WSAVA also has some good resources as well. And there's also some interesting kind of formulas or tips and tricks on how to, have adequate PPE in case there is a complete supply shortage or breakdown in the supply chain. So I will post this. This is from the University of Florida, Maddie's Shelter Medicine program. This is how to make your own surgical hand hygiene, just in case you can't get whatever product that you're familiar with to do surgery safely. We also have some surgical supply and PPE alternatives to use, like gloves, like how to re-autoclave surgical gloves. Even though this is generally not necessarily a recommended practice, it's something that people are having to do to preserve, the supplies that they have. And I just wanted to close with a case study to show an example of a program that was indeed affected, that stopped their spay-neuter program, but now has relaunched, and they've done so with a few adjustments. And so Sri Lanka, only 11 deaths, over 1,800 human cases, and borders have been and are still closed to foreigners, and a very strict curfew. So much so that it really affected their ability to go out and feed dogs, and permits were needed, et cetera, to do that. But clinics were able to reopen recently after 10-week suspension, but the regional director of health wanted to take a couple weeks before completely reopening to just make sure that things were safe, right? And so DogStar, which is the organization working that this case study is from, so shout out to them, they took these 2 weeks to do a comprehensive resurvey of the dog population, right? To really make sure that they had an accurate baseline for which they could then work from, and they knew where the dogs were, which ones were in need, and they could really target their interventions once they started up again. And so what has changed for them? So all staff members now wear face masks, and that's per local government guidelines. Staff temperatures are actually checked twice a day, but since February, that has been standard in Sri Lanka when entering any enclosed space or building in the country, so people kind of know already to do that. The staff need to maintain social distancing when it is practical to do so. Again, if you have a nurse and a veterinarian that are working together on a large breed dog, that's just not going to be practical. Like we have to balance, protection and public health also with practicality and delivering services, right? So they try to work in smaller teams when possible. And they also, again, they set up an intake area where owners are, very obviously, social distance. Their biggest challenge, however, is that, like I mentioned, it is with delays in import and export licensing for drugs and consumables. And that affects not only their supplies that they're getting from the UK, which is where they often, procure supplies from, but that's also from those supplies that are made in India. And it's a lot of very vital supplies: xylazine, ketamine, midazolam, propofol, isoflurane, suture material, catgut microchips. It's a lot. It's everything. It's almost everything, right? And so they're really trying to buy in bulk whenever possible, and keeping at least 3 months stock. Because again, we like to think that global supply chains are just very strong, but that it doesn't seem to be the case, especially now. So buy in bulk, and they've already, since restarting last week, done 221 dogs, 47 cats, and this is a photo of a lovely beach dog that has been surgically sterilized, vaccinated, and returned to her beautiful beachside community. And my email is there. I appreciate this is a lot of information. It's a big topic. So if anyone wants to email me with any questions, I'd be happy to also communicate that way as well. So thank you.
Thank you, Dr. Katherine, for those excellent tips. Maintain social distancing, PPEs, importance of communications, and following the guidance on the government advice. Thank you very much for those tips. There were a couple of questions on the Q&A that has been responded to by our fellow panelists, but if you wish to make any further comments on those, please go ahead. On that note, may I please quickly invite our next presenter, Keren Nazareth, a member of HSI, Humane Society International, who works on companion animals and engagement in Africa and Asia. Her presentation is on how to feed stray and owned animals safely. Keren, the floor is yours.
So HSI did feeding programs in India, Mauritius, and Chile. And because of those experiences, we've learned a lot about how we can safely feed. When we did this for this is a 50-day period that we were feeding, and not a single case was reported to us from any of the individuals who were involved in the program. And as you can see, they were really high numbers. We were coordinating with over 350 community feeders, 200 volunteers, over 80 people from our own teams in India. In Mauritius, we had smaller numbers, but still a wide outreach. And in Chile, we reached out to feeders in 24 cities, multiple feeders who were given food through volunteers. So those are really large numbers we're talking about. What is safe feeding? So based on our experience, we feel that safety in feeding is about creating an enabling environment for the well-being of the feeders, their motivation, their security, their physical and mental well-being. And in turn, this will, of course, make an impact to all the animals in their care. The HSI feeding model was largely about community feeders, volunteers, HSI teams, because in India, we have direct teams who actually don't stay with their families. They stay away, and they were in lockdown. So they were present at the facilities and the government. But we used technology to reach out in most cases. So I will talk about how we use the technology as we go forward. So with the government, it was important that, we had our permits. This is what you will need to be very careful about. You need your permits so that your staff doesn't get stopped by the police or the cops or anybody. If you're collaborating with other organizations or community feeders, make sure they have the permits too. Does the government have a feeding program? If it does have a feeding program, then can you tie up with that to see how you can actually, reach out to more areas, more dogs, more feeders? In Chile, we actually use the government's help to identify feeders in the various cities. And in India, when PPE wasn't very readily available, we reached out to the government and asked them to provide our team with PPE because we were being asked to go into containment zones to pick up dogs which were either aggressive or there were complaints that they may be rabid. The community. How did you identify? We identified who was feeding. We already have extensive community engagement programs in all these countries. So we reached out to those community members and found out where feeding was already happening. So we didn't duplicate that, but we tried to find out who were feeders in need. So elderly, people who may not have had enough funding or money or even access. So we launched a form called the Help Your Street Dogs form, and a lot of people filled in this information, which asked them if they would like to donate, they would like to support, would they like to feed. We got most of them, 80% of people who filled in this form were already feeders, but a lot of people said we would like to feed in new areas or areas outside our neighborhoods, and they were willing to volunteer. We kept PPE protocols ready so that anybody who came to us, we were able to provide it to them instead of, in terms of infographics, it was an easy read. The teams, so the first thing that I checked with our teams was how many of them were really comfortable doing this work, because there is a big scare. Even in India right now, governments have opened up a lot, but people are not really coming out. So we wanted to make sure that everybody was doing this voluntarily. We did a health checkup. We still ensure that, temperature checks are done every day. Insurance is a big thing to check with your team. Make sure your team is insured before they go out. Daily connects. We had every day, we had a sort of a connect, a call with everybody on the team to make sure that they didn't feel disconnected from what was happening. And, we were able to get the check on their motivation, issues and challenges that they were facing with, and trying to solve them as quickly as possible before they went out again. And everybody got a day off. So rest is really the best. We went a step further. We actually talked to families because of the situation we have in India, where our teams were not able to travel back home. This actually helped ease a lot of, mental stress for our teams, because their family members were really worried or they were feeling pressure from the family, and it was impossible for them to travel at that time. So pet owners were not a direct, we didn't reach out directly to people who were pet owners, but they obviously came in the ambit of the communities that we work with. But there were 3 important messages that we were consistently giving out. So don't abandon your pets. Keep up the regular, exercise, walking, with all the safety measures, of course. And right now we are also working on having a plan ready for if you were to contract COVID. So we are trying to now create a database in different cities of the various options a person might have if they don't have enough family support or friends who can take the dog in or the pets in when they need it. We're asking people to keep ready so that we don't see too much abandonment. India is actually going through a huge phase where cases are increasing, and so is Chile. Media was is a big supporter, and it could also be that media could give you a lot of negative news. So we did have a lot of cases where the media was covering about dogs transmitting COVID. And we had to act really fast to make sure that didn't get spread so fast. So we had to reach out to media very strongly and say that this is not really proven yet, etc. Please take it off. Because our teams go into these places to feed, or community feeders are going out to feed. So it's important that they feel safe rather than, if there's this media out there, it could mean that they would feel unsafe while they were feeding. Learning was. So try and use local media as much as possible. This is some of the information we put out there, and it's available on the HSI India Instagram handle. So you can check it out there. What are your basic checklists? So this is something everybody knows, right? Everybody has been reiterating this. The entire PPE gear is we used it, and we say that you should use it when you're going into a contamination zone if you are doing treatments or you're required to respond to cases which are absolutely necessary, like rabies or aggressive dogs fighting, etc. But otherwise, gloves and mask, when feeding. Yes, physical distancing for sure. Locations, how did we decide where to feed? So we filtered areas based on where we knew already people were feeding, and then we came down to areas where nobody was. And these were largely marketplaces. These were areas like highways, industrial zones, commercial places, where all human activity had come to a standstill. In one place, there was even around the airport. So that's how we filtered. We would also recommend doing a bit of a survey before you go to those areas, once you decide where you're going to go, so you understand how many dogs and animals you're going to be able to feed every day, or you need to feed. The government can provide information about this, and also we had to check every day if one of those areas were not contamination or a red zone or a green zone, depending on. There are apps available in India. There's a government app that's also used to tell us if places are safe to go to. So for your teams, people, provide orientation. Training is essential. We cannot assume that people know everything or understand how to do it. And when we restarted actually our clinics recently, and we did, even when we were doing feeding, we had constant practice runs, mock trials, so that people knew how to go about it. So when the vehicle comes in, how will it get sterilized? When people have to go back to their dorms, how do they, what all they need to do to get in safely and make sure nobody else, gets contaminated or something gets contaminated. I won't repeat the whole PPE gear thing, but sets of 2, that's, recommended. So if you're going out as a feeder every day, keep something that you're going to wear, keep separate clothes for outside and separate for what you keep inside. We didn't change the team. So if there were 3 people in one vehicle, that same vehicle had those 3 people continuously. We didn't change the vehicle or the teams. And this was to make sure that if one of them did contract it, then we were restricting it only to those people and we could quarantine and test immediately. The logistics. So you should have your route mapped, and that route will probably be every day, except if you find out that there are areas that you need to really address and dogs are really starving. So those things need to be decided only for the next day. We avoid and we ask teams not to go out of the areas that were mapped. Vehicles sterilized. So we use these corselin for the pumps that we use to spray the vehicles, or even phenyl if it's available. Any viricide that you can find in the market would be good. We had organized the food and water for the number of dogs and cats or other animals we were feeding per day. We had stocked up. As much as we could. Drinking water, because it's really, really hot in most of these countries right now, we suggested separate bottles, or if there was a cooler, then, separate cups or glasses. Protocol. This is something we stick to. We are checking on every day. We're monitoring. There are checklists that our teams have to sign on. So temperature checks, to make sure we can immediately get people quarantined and sent either home or to hospital if required. The rest of the stuff I've repeated, but keeping a fixed time is really important when you're feeding. So making sure that our teams went, all our teams went early morning, so 5 a.m. till about, till however long the route was. This ensured that they had minimal contact with other people, and more dogs would come for the feeding. So that is important point. And in terms of team calls and daily reporting, we feel that that's a really important mental health that you bring to, or the good, to reinforce good stories, congratulating team members or other feeders, reaching out to them, thanking them. Those are really, really important parts of your feeding program. And regular sanitizing spaces. But most.
Thank you very much, Keren. I think we lost you at the last 1 second, but we got the message. Stay compassionate, stay safe. Thank you very much for your presentation. And there has been a couple of questions, Q&As in the Q&A box. And if you wish to comment on any of the questions, please go ahead. On that note, let me invite Coralie Ferren, representing RSPCA. She will be talking to us about rehoming center protocols, intake, rehabilitation, foster, and rehoming safely. Coralie.
Okay, thank you very much. Just to introduce myself, I'm a regional manager for the RSPCA. We have around 68 animal and wildlife centres across England and Wales. So the impacts of COVID have been huge for our organisation. I'll be talking through my presentation about the steps we've taken in England and Wales. So for us, the lockdown restrictions came towards the end of March, and that included restrictions on travel, work, and social distancing requirements. We're very fortunate at the RSPCA to be part of a couple of joint groups with other animal welfare organisations. So a lot of our work on this was done through the Canine and Feline Sector Group and the Animal Welfare Network Wales. And both those groups work to advise the governments in England and Wales on animal health and welfare issues and standards. And that was really valuable for us. So what we did was work together with the other organisations to produce a sort of framework guidance, which we were actually able to get approved by the governments, which then opened up a lot of ways for working for us. So today in my presentation, I'll talk about that overarching framework, but also throwing in a few of the extra detail, because we then went away and each did our specific organisational plan according to your own structure, staffing, and all of that sort of thing. So in terms of intake, a lot of these will seem quite common sense to a lot of you, I'm sure, and they're what we'd do in normal times as well, but putting it in the context of the impacts of COVID. So in particular, only admitting animals whose welfare is significantly compromised or at imminent risk. That's taking into account the impacts on our staffing, having reduced staff and volunteers available to care for them, trying to comply with the government requirements for less travel as well and less contact between people. Only admitting the animals you have the skills and resources to care for. Again, that's bearing in mind there was quite an impact, so around 25% of our staff were furloughed. A lot of our volunteers were unable to continue coming in, or we asked them not to come in order to maintain social distancing. So making sure that the teams, the reduced teams that are left, are really able to care for those animals still. As has been mentioned in an earlier presentation, supporting owners to keep their animals. So lots of people going through a lot of financial impacts due to COVID, as well as health impacts. So a lot of the work that some of our branches has done has been around sort of supporting food banks, helping people through difficult times. We've produced advice on if you're walking someone else's dog because they're unable to leave the house. Some emergency signage there as well, that if you're taken suddenly ill, that people know that they're pets that need care for. And then for urgent situations, we were fortunate because in England and Wales, we were allowed to keep our animal centres open, not for the public to visit, but for us to continue caring for animals. And our workers were classified as critical workers, so we're able to come to work still. But members of the public can't just pop in anymore, so making sure there's measures that people, if they are really concerned, that they can access someone to help advise them. And as a last resort, we were able to go out and collect animals. So during that collection period, a lot of things again that have been mentioned already that you can do to protect both yourselves, your staff, your volunteers, and the people that you are collecting animals from. Collection by appointment only. Make sure it's carried out in a safe outdoor space or a large, well-ventilated room. We very much encouraged our staff not to enter any premises if at all possible. Briefing the people that you're dealing with about the need to maintain the 2 meters distance, minimising touching of the animals, protective equipment worn. That photo there is one of our inspectors collecting from a confirmed COVID positive household. So disposable gloves, as has been mentioned, we don't have to be careful with supply chains and not taking them from other essential health services, but they are essential for this sort of work, and disposing of them appropriately afterwards is really important as well. We developed a COVID questionnaire that we use for anyone going out to do this sort of work, so we would check whether there's anyone in the household that had had symptoms or was vulnerable or had confirmed COVID, and that would impact the measures we took as well when collecting animals. And if absolutely unavoidable, full protective equipment, and then really regular, even more so than usual, the cleaning and disinfecting of vehicles as well. So upon intake, arrival at the centre, make sure there's no contact between animals. bathing or wiping down with a pet safe cloth, and by that we just mean something that is normally appropriate for that animal. As for humans, the soap and water is most effective, but we're not promoting suddenly starting to wash cats or anything like that. It's actually more appropriate to quarantine instead. So that's what most of our centres did. And it's mandatory if you're taking an animal from a COVID positive household to quarantine for 3 days. And so that's reflective of the amount of time that the advice was that they could potentially shed that for. All holding areas cleaned and disinfected after use, and all equipment as well. So it's sort of your usual procedures, but taken even further. And any bedding they came up with, make sure you get rid of that in a way appropriate to the requirements in your country as well. So a huge amount of the work we did was actually around protection of our staff and volunteers in the centres during this period. So one of the very first steps was a review around our staffing and volunteer levels. So we did have to reduce numbers to ensure that social distancing could be maintained at all of the centres. We looked at amending rotas, where possible, separate teams, but a lot of our centres don't have big enough teams to do that and still maintain the care services. So we put in a lot of other measures as well, like staggered start times. So normally everybody arrives first thing in the morning together. We got rid of that and everyone had a slot at which they could arrive and not have contact with other people. Staggered break times, briefings moved to be outdoors, one-way systems through the centre. If you're anything like us, we've got a lot of little rooms in our centres, little veterinary rooms or little offices. Just something as simple as making sure there's signage on there to show when someone's in there, so you're not accidentally walking in on somebody else. And whilst we really would hope that the majority of the time we could maintain that social distancing, we had to plan for if there's an incident where that would be breached. For example, if there is a dog attack or something on site. So make sure that all staff are briefed and have access to PPE for if that occurs, and recording of any incidents like that as well. Biosecurity measures are the sort of the general things that have been mentioned already, washing and disinfecting all equipment between use. The things that you might not automatically think of is that includes your office equipment as well. So you'll have to have multiple people using the same telephone or sharing computers. So make sure all of those are cleaned between use as well as your animal handling and your cleaning equipment. Make sure everywhere's well ventilated. And as many times as you brief your team, some signage to remind of social distancing requirements is helpful as well, markers on the floor, things like that. In terms of animal care and veterinary services, we had to acknowledge again that we do have reduced staffing teams at the moment. So make sure we're still meeting minimum requirements for the animals that are in our care. And that's meant quite a lot more enrichment to make up for less staff time with the animals. All of our vets went on to emergencies only, and were only carrying out procedures where they could maintain social distancing. But we were fortunate that the vets that we work with, so we have some RSPCA vets, but we also work with a lot of private vets, and the majority of them were able to offer us remote consultations, remote prescriptions. We arranged that only 1 or 2 fixed team members from each centre would liaise with those vets when needed, and that's to reduce the risk of spread between teams. Neutering was quite a big impact going on hold, and we're expecting to see the impacts of that next year probably as well, but we had to make a decision once we were able to open up for some rehoming, that we would let, on case by case, let some animals, we'd normally insist they're all neutered before rehoming. We've let some go where they can be kept safely still, and neutering will happen when restrictions allow. Vaccinations, our staff are trained in those doing the ongoing vaccination courses. Normally you'd need a vet on site to oversee that, but again, that's been arranged to provide it remote oversight of that as well. So that's really helped us keep up the basics. And then making sure that anything that normally would have been done before rehoming is explained properly and will be followed up once restrictions allow. So this is the main change to our process. So there was a period when we couldn't rehome at all. So the tap of animals coming in hadn't been turned off because our inspectors were picking up the worst case animals still, but we had no outlet. And that's why all these animal welfare organisations came together to put a proposal to the government. If we can do it safely, if we can do it in this way, will you let us do this? And this is what they agreed to. So some aspects of this we had in place already, but others we've had to adapt. So trying to get as much as possible being online or a virtual process without any contact between people. So online applications, galleries of the animals, that's quite normal anyway, we were using that already. The big change was around, normally people come to our centres, view all the animals, decide which they connect with and which they like, and in turn we'll go and visit their home, carry out a home visit. None of that was possible, so we started doing all of that by sharing videos and phone interviews. And feedback from our staff was that it's really time consuming, but they also said it was really positive. They felt they're building really good relationships with those potential adopters as well through having more of that sort of contact. We did have to specify that we couldn't adopt or foster to anyone with COVID symptoms or anyone that was shielding, and that's both to protect them and to protect our staff, because you are still delivering the animals. And any paperwork and payment completed online as well. So in terms of the actual delivery, we put a limit on it that adopters or fosterers must live within an hour's drive, and that was because of the trying to limit things to essential travel and just resources as well. We had to make sure that drivers had a letter of authority. So as I said, they were key workers, and that's in case there were police checks on essential driving and that sort of thing. The planning is really important with the adopter or fosterer. They need to be aware as well that there's to be no contact within 2 meters. So fairly straightforward when it was cats or other small furry animals that are being taken in a carrier. The driver would phone in advance and advise a time, agree a safe place to leave it, on a doorstep or porch. They'd phone on arrival, leave the animal, return to their van, and then the person would come and collect that animal. The driver would stay for approximately another 15 minutes just in case there's any initial problems with the animal in its new home. The overarching guidance said to minimise time spent in owners' home. As an organisation, we took the decision that our staff shouldn't go into owners' homes at all. Bit more complicated with dogs, because normally you'd have people coming to the centres, often multiple visits, to come and meet those dogs, get used to them, build up the familiarity. And we basically had to take that whole procedure and carry it out in the person's garden or safe place instead. So there was some concern about that from our teams. Our behaviourist teams advised that we train the dogs in that process, because it'll be strange to a dog that the people involved with it are keeping 2 meters distance, sort of looping a lead over before transferring it over. So we actually trained the dogs before delivering them in that way. And we only applied this, we rate our dogs red, amber and green. So the green ones have no behavioural problems and things like that. They're really good to go. So this did only apply to those easier to home dogs. And then the follow-up support has been really important as well, even more frequent, regular follow-up to check everything's going all right and give advice. So we're now moving into another period as well. We're starting to get some loosening of our restrictions, particularly in England. And there is the option now, the government in England has said that if we can meet COVID secure guidelines, we can reopen some aspects of our centres. So that's what we're working on at the moment. A lot of the similar things that apply to the sort of protective things we have in place for staff will be similar for once we start to allow public on site. We're going through all of that element. We actually expect it to take a few weeks to have carried out all the risk assessments and put everything in place that we need, although other organisations have started to reopen already. So the things you can see on the slide there are the similar sort of considerations, hand sanitizer availability, things like that. Our plan is that when we do it, it will just be for minimal activity, still just collecting, perhaps visiting and collecting those more difficult dogs. And we do equines as well, where you need to see people handling the equine first. Just a few thoughts to leave you on. Risk assessments, if there's one thing you train your staff in, you'll be doing them pretty much on a daily basis, reviewing, updating, applying them to almost everything. So that's been a huge part of what we've done, and it's how you demonstrate that you are taking sufficient measures. In England, we've got a sort of self-certification that you can do to reassure people that when you are reopening your premises, you are COVID secure. Make sure you're updating your insurer if you're doing that, so the changes in your processes to make sure you are still covered for the processes you're putting in place. Regular reviews and communications. We're meeting on the operational teams are meeting on a daily basis at the moment with all the changes, and communicating at least twice a week to all of our teams about what's needed. And then procurement considerations and financial. I think we're going to see the impacts of this for a long time to come. That's probably a whole nother presentation in itself. So I shall leave it at that. Thank you.
Thank you very much, Coralie, for your excellent presentations. And if there are any Q&As, may I please request all participants to use our Q&A facility to post their questions or any suggestions. Now, our last presentation of today, I would invite myself. And I will be presenting on presenting my thoughts and my team's thought, I should say, on campaigning for dogs in post-corona world. And I hope you are able to see my screen. As I said, I'm presenting We in the World Animal Protection. I'm Pankaj KC once again, just to introduce. I'm the Director for Animals in Communities for World Animal Protection. And I am currently serving as a chair for ICAM as well. We in World Animal Protection is having this discussion on what does the post-corona world looks like for dogs, and what are the campaigning opportunities in order to make further case for dog population management. I'm certain that some of my team members are in this webinar, and if they want to put their thoughts, please do so in Q&A. But this presentation is very much, very much a live discussion, I should say. And I would very much encourage all the participants to contribute to this live discussion so that we can all prepare and design a robust campaign from our own ends to create a better world for dogs and to make stronger case for dog population management. So my presentation will focus a little bit on coronavirus impact on dogs. What might the post-corona world look like? And what might be the campaigning space for dog population management within that space, and what can we do? So the coronavirus impact on dogs, all the preceding presenters had touched on this subject matter. And in summary, these are some of the impacts that we have seen of coronavirus on dogs. There has been cases of increased abandonment in different countries around the world. There has been observably increased free roaming dog population. There is a reduced primary health care for dogs that has impacted on vaccination and sterilization and deworming activities, some basics, even basics like that. There has been lack of food and water, access to food and water for free roaming dogs, especially free roaming dogs in various countries across the world. We have also, on positive sides, we have also seen increased adoption of dogs. There has been a couple of cases that I have read in the newspaper where there has been 0 dogs and cats in shelter. The adoption rate was so high that there were 0 dogs and cats in shelter. So these are a generic impact that we have seen on dogs as a result of coronavirus. If you can think of any more that I have missed here, please include that in the Q&A section. So what does, now let's briefly cast our eyes into immediate future. I really hope this is the immediate future, the post-corona, post-lockdown world. And I really hope the post-lockdown world is in the near horizon. These are the two big things that are coming to hit us: the economic crisis and environmental crisis. It has been predicted that the economic crisis will be a kind of will be such that we have not seen in last 200 years. And environmental crisis will be a result of addressing such economic crisis. And some of the resulting impact of such crisis is mass unemployment, political instability across the world. We are already seeing this, and social unrest across the world. So these are some unfortunate elements that I don't think we will be able to avoid in the post-lockdown world. But what does a post-lockdown dogs world look like? What does that mean for dogs? We might see increased free-roaming dog population. We might see increased cases of dog bite. We might see more stressed pets, more anxious pets across the world. We might see increased cases of dog-mediated zoonotic diseases. And we might see higher degree of dog-human conflict. These are, again, some of the things that we thought we would rather be prepared for than react to. And as I said, I would welcome very much and would be grateful actually if you could think of any other elements that we might have forgotten on this, what the post-corona, post-lockdown world for dogs look like. Now while all of these negatives are also the possibilities, there is also a big movement going on across the world on the new normal. There is a clear indication from people across the world, represented by civil societies, that we don't want to go back to what was called normal before Corona. We want to create the new normal. And that new normal has various overlying elements to it. One is we want to create more peaceful, fair world. We want to create a sustainable and resilient communities. We want to create more animal-friendly world. We want to create environment-friendly system, the system that does not exploit environment for profit, but puts planet before profit. And the system that prioritizes the creation of more healthy communities. So this is the new normal. There is a significant majority, I would say, across the world who is fighting to create this new normal, who are making their voice heard to create this new normal, who are telling decision makers, politicians across the world that we don't want to go back to what was before. This is a great opportunity for us to reflect on what wrong we have done in the past and to create the new normal. And these are some of the overarching themes of that new normal. Again, I ask this question: is that new normal that I just described possible without happy dogs in it? I hope all of our answers is no to that question. That the new normal, in the new normal, we want to see happy dogs around the world. And is that happy, can we have happy dogs without humane dog population management across the world? So this makes the strong case for dog population management around the world in order to create that new normal. The growing movement that is around the world to create that new normal. And dog population management stands strongly to create that new normal, to create more the importance of dog population management for creating more animal-friendly world, more environment-friendly system, more healthy communities, and sustainable and resilient communities. There is a strong case to be made on behalf of dog population management role in creating that new normal. And it is there where our campaigning space lies. And it is there the answer to what we can do lies. we really need to make strong case for dog population management. Dog population management is essential for sustainable One Health approach. Dog population management is essential for building resilient communities. Dog population management is essential for sustainable urbanization. And there are many other reasons why dog population management is important. ICAM will be looking into this in coming days, and we will be approaching as many of you as possible to create such strong case for dog population management, to get your thoughts on how we do that. And we will, of course, make those any resources that we publish available for the use by anyone across the world. We need to put pressure on government for resources for making the case for dog population management. And this is one simple thing that we need to do, simple yet very, very important. We need to, at local level, and this is something that that needs to, I would say, happen at local level rather than any international organizations or coalition like ICAM to do. And that is about understanding, doing some kind of study to understand local dog population dynamics. And that is simply how does dog population, how does the population of dogs interact with the wider ecosystem in the given community? How does it interact with human beings? How does it interact? Where does the population of dog come from? Everything. So to understand such dog population dynamics at local level, and that is very important to put in place any dog population management intervention. Initiate, once we understand these dog population dynamics, initiate either the whole dog population management or the most relevant element of dog population management at local community level, engaging local people and local government. And let's start now. This is a brilliant time to start. Thank you very much. I will stop my presentation there. Any questions or comments? I can't see the chat box right now. I'll have a look at the Q&A, and I would be grateful again for your thoughts on this. Thank you very much. Okay. We have came to the end of the presentation, end of our presentation. Elly, do you want to say something right now before I close the webinar? Or any other, I would invite any other panelists as well, sorry.
Thank you. I think the main thing is to thank our attendees for sticking with us for this long. We've had some really good Q&A discussions going on, which has been great. I hope that we have answered some of your questions. If there are questions that you feel that we haven't covered that maybe we can do in future, do please let us know. You'll see on the ICAM Coalition website, there is our email address, info@icam-coalition.org. Please do drop us an email if you have any comments or thoughts for future subjects. And thank you for your time today. And thank you, Pankaj, for your inspiration for getting us to look forwards rather than what we do currently at the moment, which is to look at each day at a time. And I think it's time for a bit more vision and a bit more action for the long term.
My pleasure. Any other panelists, last words before I close the webinar? Great. On that note, I will repeat a big thank you, especially to all our presenters for sharing their knowledge and experience. I hope that has been valuable for all participants. Big thank you to all the participants for the interest and participation in this webinar. We will share the link to this webinar soon. But in the meantime, please do visit our website, ICAM website, for relevant information. And more importantly, please follow and share our social media channels on Facebook and on Twitter. Thank you very much. Let's continue to create better world for companion animals. Thank you.